Today, the level of medical care differs dramatically even between developed countries. In oncology or, for example, with neurodegenerative diseases. A mistake at the start or an outdated protocol is not just a waste of time. It is a loss of chances for life. Technological progress develops faster than the uniformity of the distribution of its fruits. And this is exactly what the WHO calls one of the key challenges of the 21st century, not the creation of new technologies, but the provision of equal access to existing ones. According to the WHO, up to 5 billion people in the world do not have full access to basic medical services. One of the most striking indicators of inequality is oncology. About 70% of cancer deaths occur in low and middle-income countries, although less than 60% of new cases are registered there. In high-income countries, the 5-year survival rate for breast cancer exceeds 85 to 90%. In low-income countries, less than 50 to 60%. It is not only a question of the availability of funds for each specific patient. It is a question of access to the infrastructure. Germany attracts not only technologies in a particular clinic. The most important thing is the system. Certified profile centers, multidisciplinary councils, clinical protocols, mandatory molecular diagnostics for a number of tumors. And in addition, CAR T-cell therapy, robot-assisted surgery, immunotherapy, which changed the prognosis for melanoma and lung cancer, and so on. Recently, a patient with non-small cell lung cancer came to me. The medical tourism agency offered her to come to one of the Asian countries and promised to burn the tumor with a laser once and for all. She turned to me because she wanted to compare the cost of this procedure in Germany. Technically, the laser surgical technique exists, but in modern oncology it is used for palliative care, for example, to restore the patency of the bronchus. It is not an alternative in the treatment of operable cancer. After studying the pictures, the head doctor of the specialized clinic gave an unequivocal conclusion. No laser is discussed. This is an early stage that requires radical treatment, tumor up to 3 centimeters, lymph nodes clean, no metastases. A lobe of the lung is removed with mandatory removal of lymph nodes. This is done in a minimally invasive or robot-assisted way. Only such an approach guarantees that the tumor is completely removed, accurate information about the state of the lymph nodes. Material for molecular genetic analysis. Burning off the tip of the iceberg would leave the patient at risk of relapse, leaving her chance of a full recovery, which is at an early stage. The main precept of medical tourism follows from this experience. Any offer of treatment must be confirmed by a real professional doctor who has seen your pictures, not a manager or coordinator.